All right, good morning, everyone. Welcome back to CYC in Practice. Today I will be your host. My name is Mackenzie, and in this episode I will be discussing OCD, depression, and substance use disorder. So we have quite a wide array of diagnoses that we will be going through. Before we get started, if you or anyone you know is experiencing a mental health crisis and needs to talk to someone, please reach out to the CMHA helpline at 613-741-6433. All right, so to get started, we're going to do OCD, obsessive compulsive disorder. According to teenshealth.org, OCD is a mental health condition that causes thoughts called obsessions and actions called compulsions. So, according to beyondocd.org, for a diagnosis of OCD, there must be a presence of obsessions, compulsions, or both. Now, obsessions are categorized as recurrent and persistent thoughts, urges, or impulses. That also involves the individual's attempts to ignore or suppress such thoughts, urges, or images. And compulsions are defined as repetitive behaviors that an individual feels compelled or driven to perform. The behaviors or mental acts could also be aimed at preventing or reducing anxiety or distress, or to prevent some dreaded event or situation, however rooted in realistic ways of prevention. That's another story, but those are the definitions. For a diagnosis, the obsessions or compulsions must be time-consuming, and the disturbances can't also be explained by another mental health disorder. So for OCD, there are also categorizations with the insight to the obsessions or compulsions. So with good or fair insight, that means the person knows the obsessions or compulsions are not true or not beneficial. With poor insight, the person believes obsessions or compulsions are probably true. They could be true, and because of that, they need to be done. With absent insight or delusional beliefs, this is a complete belief in the obsessions and compulsions. They will help. They will help me avoid a bad thing or a catastrophic situation. In this situation, the person fully believes in their obsessions or compulsions. There are also tick-related disorders that have to be considered. If there's a past history with that, a clinician should take that into consideration with diagnosis. Again, all this information is from beyondocd.org. With that being said, OCD is a disorder that can cause significant impairment. All of those symptoms, spending so much time, effort, energy on completing the compulsions or spending time obsessing over something. This takes away from other tasks and responsibilities you may have in everyday life. According to the Cognitive Behavior Institute, this can lead to a decrease in a student or a youth's grades due to obsessions unrelated to school or homework. If there are obsessions and compulsions that stem from elsewhere in life, it can bleed into the schoolwork. There's also the obsessions with perfection or perfectionism. Although this could boost a student's grade at one point, it can also make their grades suffer. If you get stuck on one assignment and you're spending too much time on it, but you can't submit it until it's absolutely perfect, you have other assignments that are being rushed or incomplete or maybe submitted behind the deadline. And this could affect their grades. There are also occasions where there may be specific obsessions, compulsions, or avoidant behavior that stem from a place of employment or relationships and social situations. So the opportunities for expansive social lives are impacted by a person with OCD's intrusive thoughts and fears. So OCD has a huge impact on a variety of aspects of a youth's life. And there are evidence-based interventions to help, mainly CBT, which has been mentioned on this podcast before, which is cognitive behavior therapy, and spoiler alert, you will hear about it again. CBT is a psychosocial treatment intended to teach individuals how to modify problematic thoughts and behaviors. There is also another therapy that is recommended by CHIO and Very Well Mind website. This is narrative therapy. So narrative therapy places an emphasis on the stories that you develop and carry with you through your life. Narrative therapists help their client put together their own narratives. This process allows the individual to find their voice and explore events in their lives and the meaning they have placed on these experiences. This helps shift the focus away from the negative and find a positive aspect on your experiences as an individual. And then we also have the option of medication. This can help balance the brain chemicals. Medication can be helpful on its own or paired with other treatments, whether this be for a short term or a long period of time. There are many medications out there that can assist with symptoms of OCD. Medication might not be for everyone, but it's an option. And like I said, you can use it with a combination of other therapies. You can do CBT and medication. You can take medication with narrative therapy. You can do all three. You can go find another form of therapy. It's not the same for everybody. There will be a different fix for one person versus the other, even if they have the same diagnosis. All right, so with that being said, these solutions are not overnight solutions. There will be difficult road ahead for a youth dealing with OCD. With that in mind, there are accommodations, especially in school, given an IEP, can be very beneficial. OCD and the symptoms can cause severe issues in environments like school. For a child dealing with OCD, they may require one or multiple accommodations to ensure they can succeed just as their counterparts without OCD would. So according to childmindinstitute.org, some of these IEP interventions could be extended test times, giving a student extra time to maneuver and deal with their obsessions or compulsions during a test can mean all the difference. Providing writing aids like a laptop for test taking, or the opposite of that. If the laptop is distracting and part of the obsessions or compulsions, you can jump in a time machine real quick and go back to paper and pencil. And something as simple as that could make all the difference for a child. You can also give them private testing rooms to get rid of any kind of triggers or other distractions in a classroom with other students. Or you can even provide an EA or an ECE in the classroom for additional support to help them read the questions and understand the questions better, or even if they just need someone to redirect them from an obsession or their compulsions. If they're having a difficult time taking the test, somebody there to help monitor and redirect their energy and their mental state can be extremely beneficial. Or one student might need all four of these accommodations, or some students might not benefit from any of these suggestions. These were the suggestions I found on, again, childmindinstitute.org, but there are many others. Overall, working as a CYC, our role in supporting a child with OCD would be to support them. This will look different depending on what aspect and what field you work in. As example, a CYC working in a school system can do things like planning with the student and the teachers for things like taking a walk when things get overwhelming, or allowing for a fidget toy so that they can play with that in class instead of obsessing over something else, or a compulsion to play with something instead of playing with pens or something they're not supposed to in the classroom, and provide them with their own, I believe they're called STEM toys. That can make all the difference in the world for the classroom setting. But a CYC working in a group home will need to do things differently. That CYC might need to focus more on maintaining a routine for their youth, since keeping a consistent routine, can be key to limiting stress that could trigger an OCD response. And this information I got from the internationalocdfoundation.org. And that's about it for OCD today. We're going to move on to depression next. So according to the Mayo Clinic, depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. It can also be referred to as major depressive disorder or clinical depression. Depression affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. So I'm going to be talking about the symptoms for diagnosis of two different aspects of depression. We're going to talk about major depressive disorder and persistent depressive disorder. So according to the National Institute of Health, the DSM-5 criteria for major depressive disorder is 2 weeks of persistent depressed mood or irritability, persistent loss of interest, accompanied by at least 3 of the following: weight loss or failure to gain weight, change in appetite, insomnia or hypersomnia, psychomotor issues or agitation, fatigue or loss of energy, excessive or inappropriate guilt, feelings of worthlessness, indecisiveness or diminished ability to concentrate, or recurrent thoughts of death or suicidal ideation. So for major depressive disorder, 2 weeks of persistent depressed mood accompanied by 3 of the things I listed. At least, could be more. So for persistent depressive disorder, the difference is that the episode of depression, instead of 2 weeks, is at least a year of depressed and irritable mood, accompanied by only 2 of the following symptoms: hopelessness, insomnia or hypersomnia, poor appetite, fatigue or low energy, low self-esteem, indecisiveness, or poor concentration. So again, these are the DSM-5 criteria that I was able to find on the National Institute of Health website. So the impact of these symptoms and of depression on a young person, can be catastrophic. The symptoms of depression may affect many aspects of a young person's life and probably will. Some of the main symptoms I found for the effect depression has on your overall life is low self-esteem. A person with depression may think poorly about themselves and think they are not worth time, effort, energy, money, whatever it may be. It also can be a low social trust. Someone with depression might be unsure of how to truly trust the people around them. And that, coupled with low self-esteem, they might think to themselves, why would other people like me if I don't even like myself? This could lead to social avoidance. Avoiding social situations can diminish their social circles and increase isolation. All of these things can attribute to poor performance at school. Seeking out communities online could be a way around this, but unfortunately there are a lot of bad websites out there that can lead someone in the wrong direction as well. Another issue that a person with depression might face, another impact they might have to deal with is issues with anger management. Depressed people often feel angry or become hostile. This can lead to issues at home or at school or with their friends or at work. Being angry and expressing that emotion often will affect interpersonal relationships, and that comes back to low self-esteem, social avoidance. A lot of these impacts interact with each other and feed into the depression, into the sadness. There are many evidence-based interventions that can be used to help someone with depression. Again, CBT, cognitive behavior therapy, can be a huge help for someone with depression. You're modifying the problematic thoughts and behaviors you're having. Someone with depression, a lot of their problematic behaviors will likely be stemmed towards themselves or the people around them. And cognitive behavior therapy can help modify and circumvent these feelings and replace them with something else. And like with OCD, you can also use medication, whether that be on its own for long, short periods of time, or with other forms of therapy. Medication can help with the imbalance of chemicals in your brain, and you can see a physical change, but they don't work for everyone, which is unfortunate. Sometimes you just have to find the right mix. Some people give up before that happens, but you got to keep going, and there is a way. There is a way out of it. There is also self-care is a big thing for someone with depression. Understanding and practicing proper self-care is so important. When dealing with depression, you have common symptoms like low energy, low levels of motivation, and regular things often get ignored in your day-to-day life. Things like doing laundry, washing the dishes. They don't seem as important when you're dealing with depression and depressive thoughts or even suicidal ideations. You're not going to be worried about washing the dishes or making sure you have clean clothes to wear. Self-care is the boring stuff. As one of my professors says, self-care is boring. You gotta eat, sleep, take a shower, do your laundry, do groceries. It's boring, but it's necessary. And often when these things get ignored, depressive episodes and depressive moments can seem worse. You're overwhelmed with your own thoughts and feelings, and you look over and you got a big pile of laundry on the floor. It's not a good sight. It's not helpful. So self-care is a really big, important process in treating depression. Easier said than done, 100%. All of this information you can find on the childmind.org. Also, there's a lot of information available on the World Health Organization website. These treatments, like with OCD, like with most things really, are not an instant fix. So there are IEP recommendations and IEPs that can be introduced into a child's life according to childrenshealth.com. Provide things like providing a designated calm down area when class environments are too overwhelming. You can have a specific support person at the school, such as a counselor or a CYC, for check-ins as needed. Incorporating scheduled breaks, creating a plan to help the student make up work if they are absent or can't be in class, allowing students to leave class for 5 minutes, go somewhere else, talk to another teacher, see the principal. This can be extremely beneficial. Giving a student extra time between transition periods so that they don't have to be in big crowds can be a great help. Creating a plan with the student for goals that they would like to set, realistic goals, SMART goals, are important. And These are all steps that can be provided for a student in their IEP to ensure a young person struggling with depression has proper support and a better chance of succeeding and less chance of sinking deeper into their disorder. So throughout all of this, the role of a CYC should be ultimately to support and guide a young person who's navigating their life with depression. It's not easy to be that youth who is going through life with this disorder, especially if they have low self-esteem and low value for themselves. You could be the only person in that youth's life there to represent their best interest, because with a disorder like depression, whether it be major or persistent, that child is not advocating for themselves, and that's what you need to be in their life. You need to take the time to let them know that you care, build a connection. A lot of this way easier said than done, but that's the job. All right, so we're going to move on to our last disorder, and that's going to be a substance use disorder. This one is a big one. The definition of substance use disorder, according to Johns Hopkins, it's a term used to describe a pattern of using a substance or substances that cause a significant problem or distress. These problems or distress may be missing work, school, or important life events, or even using the substances in dangerous situations, such as driving a car. So for a diagnosis of substance use disorder, according to Verywell Mind, the DSM-5 criteria is taking the substance in large amounts or for longer than you're meant to, wanting to cut down or stop using the substance but not managing to, spending a lot of time getting, using, or recovering from use of the substance, cravings and urges to use the substance, not managing to do what you should at work, home, or school because of substance use, continuing to use even when it causes problems in relationships, giving up important social, occupational, or recreational activities because of substance use, using substances again and again, even when it puts you in danger, continuing to use even when you know you have a physical, psychological problem that could have been caused or made worse by the substance, needing more of the substance to get the same effect, so a higher tolerance, development of withdrawal symptoms, which can be relieved by taking more of the substance. So these are 11 diagnostic criteria. There are also specifications for this illness, for severity of the illness. These categories are mild, moderate, and severe. So for mild, you need to be experiencing 2 or 3 symptoms that indicate you have a mild substance use disorder. 4 or 5 symptoms indicate moderate substance use disorder, and 6 or more symptoms indicate a severe substance use disorder. Again, this information can be found on verywellmind.com. So, the impact of this disorder is huge on a person's life. According to the National Library of Medicine, substance use can infiltrate many aspects of a teen's life. This can be due to overuse or using in inappropriate environments, like at school or at work, or due to experiencing withdrawals, making everyday life difficult to maintain. Using drugs or alcohol or any substance can reduce academic achievement and disrupt academic progression, impacting the education of a young person experiencing substance use disorder. There's also the physical impact. Heavy adolescent substance use can lead to problems with working memory and attention. The developing brain is very sensitive and we need to be careful with as a teen, you have to be careful what things you put in your body. Drugs, definitely not a good one. They cause problems. The developing brain is very sensitive, but there are evidence-based interventions that can be used to make a difference in a young person's life. Again, so according to the National Library of Medicine, the most effective forms of interventions for a young person with substance use disorder are family-based therapy, cognitive behavioral therapy, and multi-component psychosocial therapy. So family-based therapy, that's a new one for this podcast. This gets the whole family involved. This form of therapy gets parents, guardians, other caregivers, and even siblings to participate in helping and supporting the youth dealing with addiction. This treatment helps the youth with their behavioral management, helps promote positive relationships, and it encourages self-regulation and stress management. When you have a whole team of people working with you to work through this one problem, it helps. It really makes a difference to have that kind of support from your family, your friends, your social circle, your bubble of people that you feel safe with. Unfortunately, that is not an option for everyone, so we have other treatment options. We're coming back to CBT with this one. Most common form of therapy for substance use disorder. CBT helps with a person with substance use disorder modify the thoughts, behaviors behind the substance use or during the substance use. It helps really get to the root of those problems. There's the multi-component psychosocial therapy, which is basically just a big way of saying a combination of CBT, family-based therapy, motivational interviewing, other things like mindfulness-based therapies. These can all be used to treat mental health conditions like substance use disorders. And another good little sprinkle on top is there are youth support groups, not just for substance use disorder, but for all of these disorders. You have youth support groups for substance use disorder. You have things like AA that would offer additional support from a social environment of people who have experienced similar situations. If you're looking for somebody who understands where you are and where you've been, and hopefully where you're going, AA is a great place to meet mentors and find people that understand you. So for a youth experiencing substance use disorders, I wasn't able to find IEP recommendations related to that diagnosis in particular. It's not really done in Ontario, at least. There's no precedent for it that I could find. There are some alternative schools here in Ottawa. There's Norman Johnson that will see substance use disorder as a disability that could get you qualified for an IEP. But in the regular education system here in Ontario, an IEP for this disorder is not something that's done. There are goals within the school system that can be set with teachers, EAs, principals, counselors. Things like socialization without substances. Even if that's not possible every day of the week, go for a few days of the week, 2 days, 3 days, and move it up. You set goals for not doing substances at school or missing less days. There's not a whole lot of research or information available for IEP recommendations for this disorder. But there are steps you can take as a CYC in supporting a youth dealing with a substance use disorder. A lot of substance use disorders are comorbid, so they have an underlying mental health issue that needs to be addressed. So that 100% needs to be addressed as well. Whether the youth is coming into your care receiving no treatment for their substance use, having tried and failed, or if they've already started their journey and are doing better, it's your job as a CYC to make sure that they have one person they can turn to, one resource, somebody that can help them, listen to them, refer them to other programs. Someone trying to quit using drugs is experiencing not just physical but mental struggles. So we need to be there for them when they may feel like they're lacking support, or if they don't have any other support in their life. Every case will be different, but above all, a child and youth care practitioner's job is to care, regardless of diagnoses. OCD, depression, substance use, anxiety disorders. Your job is to be there to care and provide support for the youth you're dealing with and their family sometimes. But it's not always the case. Sometimes you're the only person there. With all that being said, we've learned about 3 different diagnoses for mental illnesses today. I hope you got some good information. Psychoeducation is a very important tool when learning about mental illness, whether you've been diagnosed or someone you love has been recently diagnosed, or you just want to learn to help end the stigma. I appreciate you tuning in and listening to our podcast. Hope you learned something, and all of the links and websites used will be provided for further information. Again, I have the phone number for the CMHA helpline. If you or anyone you need is experiencing a mental health crisis, please call 613-741-6433 or 911 if it's an emergency. Thank you, and I hope you enjoy our next episode. We have Lexi, who will be your host. She's going to talk to you about more mental illnesses, mental health issues, and hopefully you'll come out of these episodes an expert. Just kidding, but you'll know more.